everyone, and thank you for attending my poster presentation entitled You're Just a Voice, Examining Internal Medicine Residents' Experience Completing Goals of Care Conversations During the COVID-19 Pandemic. So why is this important? A patient's goals of care is critical to most internal medicine care plans. Goals of care conversations that are explored in more depth and breadth result in better alignment between a patient's preferred and the physician's prescribed goals of care. The COVID-19 pandemic has introduced several pressures that may affect goals of care conversations, including restrictive visitor policies and AGMP policies. The GOOD framework, which is comprised of exploration of a patient's goals and values, discussion of care plan options, exploration of patient opinions, and documentation of the encounter, has been recommended as a framework to perform goals of care conversations during the pandemic. We performed a qualitative analysis using semi-structured interviews with internal medicine residents to explore how the COVID-19 pandemic has affected internal medicine residents' experience completing goals of care conversations. In our results, we examined three main components. How did residents learn to have goals of care conversations? How did they have goals of care conversations? And how did the COVID-19 pandemic affect their conversations? Residents reported learning goals of care conversations through a variety of channels. They reported limited didactic teaching, citing 1 to 2 lectures throughout their residency. Some residents received focused goals of care teaching regarding the pandemic, but this was not universal. Residents reported that they relied mostly on learned techniques to navigate goals of care conversations through watching more senior physicians complete the conversations, as well as their own lived experience. The 5 main steps to having goals of care conversations is reported in Table 1. This somewhat, but does not completely mirror the GOOD framework. Residents did not believe they followed a specific framework when completing their goals of care conversations. During the COVID-19 pandemic, residents felt an increased urgency to have these conversations due to the rapid progression of illness in some patients. However, residents reported that restrictive visitor policies contributed to dehumanization of all parties. Further, residents described difficulty to fully encompass the severity of illness through language alone. Lastly, the unpredictable clinical course of COVID-19 made it difficult for residents to anticipate and thus discuss the clinical trajectory. Overall, residents felt that goals of care conversations during the COVID-19 pandemic were wrought with limitations that contributed to moral injury. Future direction should examine whether goals of care conversations beyond the COVID-19 pandemic also result in moral injury. Further, the elements described in Resident Steps goals of care conversations, including introduction of expected clinical course and discussion of potential care plans, may be limited for junior trainees who have had limited clinical experience. Further studies and educational programming should consider how to more aptly support junior trainees as they learn to complete these conversations. Special thanks to the HPK Center and SEAT for sponsoring this project. Thank you.